topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Good morning, Tennessee. Welcome to another Ask the Expert show, where we always bring you the finest experts in the field of legal, health, financial, and home improvement. I got to tell you, our next show is so special to me because I just had cataract surgery. And our great Dr. Kyle Jones of the Wang Vision Institute is the one, he didn't even know, he is the one who motivated me about getting cataract surgery. Good morning, Dr. Jones.
Good morning, Steve. How are you?
You know, I got to tell you, Dr. Jones, you know, we have you and Dr. G, but Dr. Jones, I asked you a question. I think it was a call from one of our listeners said, what happens if you don't get the cataract surgery done? And you said, you know, there could be possible blindness. As soon as you said that, and I got off the phone, I called my ophthalmologist and I said, how soon can I get in?
Right.
Because I was a procrastinator, Dr. Jones.
Yeah. And I see that every day in my clinic, patients who, you know, clearly their cataract had been developing for many, many years. And it's now to the point where their vision, I mean, they're basically either legally blind or truly blind. And it makes the cataract surgery a little bit more difficult and increases the risk of complications the longer you wait. If you're not bothered by your vision, then you don't need to have cataract surgery. But I tell most patients, if you're starting to notice your vision declining and noticing night vision issues and things like that, cataract surgery is very safe, especially in the early stages of cataract. And the recovery is very straightforward overall. So it's worth considering doing surgery and not waiting to the point where your vision is so bad you basically can't see anything. It's not a good idea to wait that long.
You know, I got to tell people, I want to use part of the show because I was a procrastinator and I knew my eyes were bad because at night, if you look at a star, it's like it's not a star anymore.
Right.
And night driving was tough, but I'm a guy, I can get through it. Yeah. But I got to tell you, now seeing the difference in my eyesight.
Yeah.
And I want people to know, you think eye surgery, ooh, that. Yeah. I got to tell you, I didn't feel a thing.
Yeah. Yeah, that's kind of a misconception about it. Most patients will think it's some kind of really like a major surgery, which it is intraocular surgery. So in some ways it is a major surgery, but the technology that we use for cataract surgery has evolved so much over the last, even last decade, it's evolved tremendously. It is a very minimally invasive, very predictable, very low risk procedure overall. And it's very quick as well. It really takes a matter of usually minutes per eye to do. And it's done at a surgery center, and usually you go home right after surgery that very same day. And the recovery is very quick as well. You know, 30 years ago, cataract surgery was very different. We sometimes had to admit patients to the hospital, make very large incisions, use sutures or stitches to close incisions. And that's really almost never the case now. So it's really become more like a little minor procedure in some ways, even though it is still technically major surgery. The technology has allowed the safety profile of the procedure to just be nothing like what it was 30 years ago.
Well, you hear that you're going to need anesthesia, but it's not what you think because I
Yeah.
was awake the whole time.
Yeah, the anesthesia that's used at the time of cataract surgery, really, it's just kind of sedation. So you really are awake for the procedure, but you're in kind of almost a twilight zone. And some patients respond a little differently to sedation than others. Some may kind of start to fall asleep a little bit, but it's really meant to just kind of relax you and just make you slightly disoriented to what's going on. So you're not totally aware of every little thing that's happening. And you're really just kind of looking at a bright light the entire time. And the surgery's over in a matter of minutes. And you really don't even realize what just happened. You really don't, as you alluded to, you don't really feel much of anything. Some patients may feel occasional pressure on the eye, but there's no pain during the surgery.
So I want to ask you a question because Wang is one of the finest ophthalmology institutes in the country. People know, my doctor knew who Wang was.
Yeah.
And I got to, the drops you do before, do you do 3 different drops or have you combined it into one?
We have a combination drop that includes antibiotic and steroid drops and everything you need prescription-wise, all in one bottle. That we have
Yes.
in our office. And so, yes, patients start taking that drop one time a day, a few days before surgery, and then they follow a schedule afterwards. But it's all in one bottle, which is really nice because that really is convenient for patients. A lot of patients don't want to have to deal with numerous different bottles that they have to use after surgery. It gets a little bit confusing. If everything's all included in one bottle, it makes it so much more straightforward.
Absolutely.
Yeah.
'Cause a friend of mine had 3 different ones,
Hmm.
and she was telling me how confusing it was to make sure
Yes.
did I do that one? No, I think I've already done that one. But
Yes.
so I'm so glad you do just the one combination.
Yes, it's been a game changer. It makes it so much easier and so much more convenient for patients. And if, we need to add on some additional drop afterwards, I mean, 2 bottles is not a whole lot for most patients as well. But for 90% plus of patients, it's just 1 bottle they take and
That's
4 times a
wonderful.
day. Yeah. And so it's an easy schedule to follow for most
So,
patients.
Dr. Jones, you're not going to believe the one question I asked during the surgery was, can you tell that I had LASIK? And he
Yeah.
said he could tell.
Yeah.
It's
Yeah.
been
Yeah.
15 years.
Yeah. You mean during the cataract surgery?
Yeah.
Yeah. You can look at the eye and you can still see the edge and the remnant of the old flap when it was created.
Wow.
And yeah, we use a very high powered microscope for cataract surgery, so we can visualize details very well. And yes, for vast majority of patients who had LASIK,
I was shocked.
Yeah, that's correct.
So people want to know, since I told people about the surgery and they knew you were coming on, why do some states allow you to do both eyes at one time and other states only one eye at a time?
Yeah, that's a great question. It kind of depends on the insurance regulations that are going on in that state and what kind of surgery center one is operating in. Vast majority of states and surgical situations, the eyes are going to have to be done on separate days just because that's the rule of the surgery center and the insurance companies or Medicare that we're contracted with. It's really purely a kind of an insurance and regulation thing. In other countries where they have a different governing body for insurance and things like that, it's very common to do both eyes on the same day. But in this country, it's not actually super common to do both cataract surgeries on the same day. Usually they're separated by at least a day apart. At our surgery center, oftentimes it's a week apart, but there are some surgery centers in this country that are more like office-based surgery centers, and they have different regulations and different contracts with insurance, and they will do both eyes on the same day. And I know several surgeons who do that.
So my final question, then we're going to talk about LASIK and SMILE. But so after you've had the surgery, so I've only had one eye, I'm having the next eye done next week.
Yeah.
Does my vision continue to get better, or is this the best now after 1 week? How does that work?
No, I mean, usually the majority of the vision recovery has happened by about 1 or 2 weeks after surgery. But I tell most patients the total recovery time in terms of total optimization of your vision is about 3 months, because at 3 months, we'll examine your eyes. And if there's any little cloudiness that's developing on the little membrane behind the lens implant, which is called posterior capsule opacity, it's just where that membrane, as everything heals, starts to get a little cloudy, and it can make the vision a little blurry still when that occurs. And there's an additional little laser touch-up that we can do in our clinic to make the vision a little bit clearer, but we have to wait 3 months for that after surgery before we can do that. So I tell most patients, give it at least 3 months before we see where you're at, and we might need to do that additional little quick laser procedure to make the vision a little bit clearer. But for most patients, most of the vision is going to be recovered by 1 to 2 weeks. Yeah.
And you can absolutely go back to work the next day. I
Yeah.
was actually working that afternoon.
Yeah. I mean, most patients can resume pretty much everything as normal the day after surgery. It's just, basic restrictions the first week, like water getting in the eyes or avoiding aggressive exercise and heavy lifting and things like that. But you can work on the computer, you can read, you can drive if you feel comfortable. Some patients may feel like it's still a little too blurry to drive the very next day after surgery, but usually within a couple of days, you're pretty much good to go with everything as normal. Yeah.
I just thought of one other question. I'm on Ozempic,
Yeah.
and they said you have to miss that week. What
Yeah.
does the Ozempic have to do with the surgery?
It has to do with the sedation. So Ozempic
Oh,
or any of these medications, the way they work is they delay gastric emptying. So food, this is why they kind of suppress appetite quite a bit. Food kind of very slowly exits the stomach. And so if you're on that medication, it could be some food is actually still in your stomach. And when we sedate you at the time of surgery, we don't want any of that to come up and regurgitate at all. That is something that can theoretically happen, and that puts you at risk for aspirating and things like that, which we don't want during the surgery. So yeah, usually we have you stop taking that medication before surgery.
I didn't look over at the doctor at all. Well, they had me mostly covered up, my face. So, are you looking into a microscope or something that enlarges everything for you?
Yeah, we're looking through literally a microscope that's inverted on its side like that, and we can see the structures of the eye in very large, very great detail. And so that's how we're able to do the surgery. Yeah, because we're operating on a very
Amazing.
small space. I mean, the diameter of the space we're working in is only about 10 to 11 and a half millimeters or
Yeah.
so. So this is a very small space with very small instruments. So yeah, it's got to be magnified hugely to be able to see everything well. Yeah.
Well, I just want people to know, don't procrastinate like I did. Get it done. It's the easiest surgery. I'm telling you,
Yeah.
it will change the way you see things.
Yes.
I joked with my doctor. I said, the only thing wrong was I thought I had a beautiful wife, and then I had the surgery. She wasn't so, I was kidding anyway. So everybody knows I've had LASIK, the
Yeah.
greatest surgery, Dr. Jones. It made such a huge difference, but now there's other alternatives now.
Yeah. There's even in the realm of just laser vision correction at Wang Vision, for example, we do SMILE mostly, which is small incision LASIK. It's the most state-of-the-art, kind of most advanced form of laser vision correction, where we don't have to make a flap in the cornea. So that's, a lot of people don't realize that with LASIK, a laser will actually make a very thin flap in your cornea, the front part of the eye, that you peel back, and then a laser will do the vision correction. Now with SMILE, we don't have to do that at all. The laser does the treatment within the cornea and just makes a very tiny incision at the top of the cornea away from all the corneal nerves. So there's a lot less dry eye with SMILE. I'm really not seeing a significant amount of post-operative dry eye that we may have seen in the past with some patients who have LASIK. So SMILE's been a huge benefit to our practice in terms of vision correction. We were the very first practice in the state of Tennessee to start doing SMILE when it first got FDA approved many years ago. And now it's the main vision correction that we do. We do far more SMILE than traditional LASIK, actually. We still do traditional LASIK if you're not a SMILE candidate, but SMILE's been huge and has been really a huge success for us. It's got exactly the same results and same outcomes as LASIK, but just less postoperative issues like dry eye and things like that. So we tend to recommend SMILE if you're a candidate for both procedures. And then there's other lens-based procedures as well. So if you're not a candidate for LASIK, or you don't want to have LASIK, or the idea of laser vision correction kind of scares you or turns you off a little bit, or maybe your cornea is not a candidate because you have dry eye syndrome, there's other options. There's lens-based options like the implantable permanent contact lens and forever young lens surgery. So there's options. If you're not even a LASIK candidate or you don't want to have LASIK, we have other options for you as well that work very well. And we do all of these vision corrections at Wang Vision Institute. We do the entire gamut of vision correction surgery.
Why did they name it SMILE?
Yeah, well, it's a acronym for a complex medical name. It's small incision lenticule extraction, but the more colloquial terminology that's used is small incision LASIK. Okay, so because it's a laser vision correction procedure, but it's not actually creating a flap at all. So LASIK involves a flap, but with SMILE, it's all through a small incision instead. So it's just an acronym for the medical terminology.
So, Dr. Jones, we have a lot of older people who listen to the show. And we are getting inundated by questions. People wanting to know, does Medicare handle LASIK or SMILE?
Does Medicare cover LASIK or SMILE?
Yes.
No, generally not. No, Medicare and really most insurance companies will not cover LASIK or SMILE at all because it's considered an elective surgery. Some vision insurances may give you some kind of voucher or some kind of discount or funds to have vision correction surgery, but not every vision insurance. It's not super common that I see that, but I do run into that occasionally, or I'll see that. But no, medical insurance, and especially Medicare, no, it absolutely will not cover it.
Okay, I guess they haven't had eye problems before.
Yeah. Right.
So who's an ideal candidate for SMILE?
Yeah, that's a great question. The ideal kind of candidate for SMILE or LASIK, really the two procedures are identical in terms of who's a candidate for each. There's slight differences, but for SMILE, in general, it's going to be patients in the realm of age 40 to 50 or younger. So 18, so around 40 to 50 with a nearsighted prescription. So you have a minus number in front of your prescription. SMILE can treat astigmatism as well. So if you have some astigmatism in your glasses or contact lenses prescription, SMILE is very effective at treating that as well. That's generally going to be the age range, and the prescription range is minus prescriptions anywhere from -1.5 to -2, all the way up to, very high prescriptions like -8, -9, things like that are going to be usually candidates for SMILE in most cases. But we do a variety of testing in our clinic because there's a lot of factors that go into what procedure we recommend for a certain patient. And we're going to look at a lot of different factors in our clinic on all of our testing that we do to see which procedure is best for you. And for some patients, it may not be LASIK or SMILE. It may be the EVO permanent contact lens, or it might be lens replacement, depending on their age. And so we'll make our recommendation in clinic what's best for the patient.
Well, I hope I get this right. I read an article the other day. It was about EVO, ICL.
Yes.
I mean, it sounds like a futuristic. What is that?
Yeah. So EVO, ICL, which stands for implantable contact lens, and EVO is just the brand name, the manufacturer's name for it. It's a lens implant, and it looks very similar. Actually, if you look at it, it looks kind of like a contact lens, but it's designed to actually be able to go inside the eye. So you don't actually have to place it on the surface of the eye and remove it every day when you go to bed. It's a permanent contact lens. So it's designed to go inside the eye, right behind your pupil, and it vaults over your natural lens and corrects prescriptions. We're most commonly doing EVO for really high prescriptions and people that aren't candidates for LASIK or SMILE. and it can treat astigmatism as well, the EVO. It works remarkably well. I mean, the outcomes with EVO are superb. I would say for most patients, especially if it's a higher prescription, it's going to provide better vision quality actually than LASIK or SMILE could achieve, just because the lens implant is such a strong refractive good material, and it can last the rest of your life. There's patients I see come to my clinic now who had maybe older versions of the EVO lens. It's been updated throughout the years, had surgery like over 20 years ago now, and now they're coming in actually needing cataract surgery a lot of the time because they're, you know, in their 60s or 70s, and they had surgery over 20 years ago, and the lens implant still looks pristine, and it's still working perfectly to correct their prescription. So it's a remarkable surgery. Vast majority of patients who come to us interested in vision correction surgery have never heard of it. And it's really a shame because it's a fantastic surgical procedure. The safety profile is the same as LASIK and SMILE. It's a very safe procedure, and it works remarkably well.
Why would someone choose that over LASIK or SMILE?
Yeah, that's a great question. The most common reason why we as the doctors would recommend EVO instead of LASIK or SMILE is going to be because you're just simply not a candidate for LASIK or SMILE, because usually it's going to be because your prescription is too high or your cornea is too thin to safely do LASIK or SMILE. We'll recommend EVO ICL, no question about it. Some patients come to us very rarely, but maybe they're just not interested in LASIK or SMILE. They just don't want to have that. They're interested in a different option. And so EVO is a great option for those patients. If they also have a history of chronic dry eye, they're on maybe several different prescription drops for dry. They have to take artificial tears throughout the day. They have dry spots on their cornea on examination. The EVO ICL is really nice because it doesn't increase the rate of dry eye at all. It's a lens implant that goes right behind the cornea. So it's not a laser surgical procedure on the cornea at all. So it's not going to alter the dry eye that one has at all. So those patients are a good candidate for EVO as well.
Dr. Jones, I gotta tell you before we go off the air, I have so much respect for your area of medicine. I mean, what you can do now, say what you did 20 years ago, and the difference that you make in someone's life is just so amazing. Tell people how they can reach your office.
Yeah, that's a great question. We have a website. It's wangvisioninstitute.com, where there's links that have information about all of the various vision correction procedures that we do. There's also a link there for booking or scheduling a consultation if you're interested in improving your vision with us. That's all available on our website. Our phone number is 615-321-8881 as well. And we're located in Midtown, Nashville, Tennessee.
Well, you are my new hero, Dr. Jones.
Oh, thank you.
Thank you for motivating me. It's just such a difference. My eyesight at night, especially now. Yeah. And I can't wait to have the other one done. Dr. Jones, we can't thank Wang Institute enough. We'll see you again next month.
Thank you. Good to see you.
That's Dr. Jones of the Wang Vision Institute. Boy, he saved me. He motivated me to go get my cataracts done. That's going to do it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.